In this video, we will detail the external configuration of the heart. To do so, we will start with a general overview, followed by the external configuration of the heart, the cardiac measurements and shapes, the heart's topographical relations, some clinical notes, and finally a conclusion. The heart is a vital muscular organ, located in the thoracic cavity, between the lungs, slightly to the left of the midline. Its primary function is to pump blood throughout the body, supplying oxygen and nutrients to tissues, and removing carbon dioxide and waste products. Structurally, the heart has a pyramidal shape, with a broad base and a pointed apex. It consists of 4 chambers, 2 atria at the top and 2 ventricles below. The right side handles deoxygenated blood, sending it to the lungs for gas exchange. The left side receives oxygenated blood and pumps it into systemic circulation. This dual pump system operates through a series of valves, ensuring one-way flow and efficient circulation. The heart beats around 70 times per minute, controlled by its own electrical conduction system. Though small in size, the heart plays an enormous role in sustaining life. The heart is located in the thoracic cavity and occupies the anterior mediastinum. It has a pyramidal shape with a triangular base. It functions as a discharge and suction pump of blood, capable of rhythmic contractions at a rate of 64 to 74 beats per minute. It is divided into a right heart and a left heart. Its average weight is 270 grams in men and 260 grams in women. Let's detail now the external configuration of the heart. Due to its shape, the heart has 3 surfaces, 3 borders, a base, an apex, sulci, and auricles. The 3 surfaces of the heart are the anterior or sternocostal surface, the inferior or diaphragmatic surface, and the left lateral or pulmonary surface of the heart. Each of these surfaces is divided by the auriculoventricular sulcus into 2 segments. One anterior or ventricular, and the other posterior or auricular. The anterior or sternocostal surface of the heart faces forward and to the right. The ventricular segment has 2 zones. The posterior or arterial zone, entirely occupied by the aortic orifice and the orifice of the pulmonary artery. The anterior zone is divided into 2 fields by the anterior interventricular sulcus. Meanwhile, the auricular segment overhangs the arterial part and extends laterally and forward by the auricles. The right auricle, triangular in shape, covers the anterior face of the origin of the aorta. And the left auricle, with only its anterior tip belonging to the anterior face of the heart, has a sinusoidal shape and covers the origin of the pulmonary artery. The inferior surface of the heart, also called diaphragmatic surface, rests on the phrenic center and is primarily formed by the right ventricle. It is slightly convex and inclined downward and forward. The ventricle segment is divided by the lower part of the interventricular sulcus into 2 fields, left and right, whilst the atrial segment is more narrow. And the lateral surface of the heart, also called the pulmonary face, it faces left and backward. It is convex from top to bottom. This convexity is especially pronounced in the ventricular segment. In the auricular segment, the left auricle wraps around the lateral left side of the pulmonary artery. The 3 surfaces of the heart are separated from one another by 3 borders that all converge towards the apex, 1 on the right and 2 on the left. The right border is located between the anterior surface and the inferior surface of the heart. And the 2 left borders, 1 superior and 1 inferior, are rounded and separate the left lateral surface from the anterior and inferior surfaces. Let's move now to the base of the heart. Formed by the atria, it is roughly flat from top to bottom and transversely convex. It faces backward and slightly to the right, and is divided by the interauricular sulcus into 2 segments. The left segment responds to the orifices of the 4 pulmonary veins, and between the right and left veins where lies the sinus of Haller. And the right segment responds to the superior vena cava at the top, the inferior vena cava at the bottom, and is limited on the right by a vertical sulcus, the sulcus terminalis. The apex of the heart is divided by a slight depression that connects the anterior interventricular sulcus to the posterior interventricular sulcus into two parts. The right part, smaller, corresponding to the right ventricle, and the left part, larger, belonging to the left ventricle and occupying the very apex of the heart. The sulci of the heart define the outer boundaries of the heart's chambers. The coronary vessels run within them, masked by adipose tissue. Three main sulci can be identified on the heart's surface: the interauricular sulcus, the interventricular sulcus, and the auriculoventricular sulcus. The interauricular sulcus separates the right atrium of the left atrium. Convex on the right on its upper part, it corresponds on the left to the pulmonary veins. Concave on the right in its lower part, it corresponds on the right to the left border of the opening of the inferior vena cava. The interventricular sulcus separates the anterior surface into two fields corresponding to the right and left ventricles and the diaphragmatic surface at the back. It divides the apex of the heart into parts, with the larger part, that is of the left ventricle, forming of the apex of the heart. This sulcus is traversed by the interventricular vessels. The auriculoventricular sulcus separates the atria from ventricles. It is concave in front, encircling the arterial zone of the ventricular field. It runs along the right atria and curves around the right border of the heart to pass over the diaphragmatic surface. On this surface it connects with the posterior interauricular and interventricular sulci. Let's talk now about the heart's auricles. The right auricle is triangular with a posterior base, located in the right atrium and with an anterior apex in contact with the right border of the pulmonary artery. It partially covers the right auriculoventricular sulcus. However, left auricle's lower border covers the left auriculoventricular sulcus, and its apex hangs over the anterior surface of the left ventricule. Let's delve into the cardiac measurements and shapes. Radiography allows for the measurement of the cardiac image. It provides information about the shape and size of the heart. The possible parameters on a frontal chest X-ray are: the maximal transversal diameter, determined from the midline of the chest. The maximal width on the right is measured and added to the maximal width on the left. The longitudinal diameter represents the distance between the notch of the right border of the heart and the cardiac apex. The transversal diameter indicates the maximum width of the heart. It is measured perpendicular to the longitudinal diameter. Width of the aorta is the distance between the notch of the right border of the heart and the aortic arch. And the cardiac inclination angle is the angle formed by the longitudinal diameter with the horizontal plane. This image illustrates the three main morphological types of the cardiac silhouette based on its axis. Spread type heart with a more horizontal axis, approximately 25 degrees. Average type heart with a mid-position axis, approximately 45 degrees. Vertical type heart with a steep, upright axis, approximately 53 degrees. And this image shows the frontal, A, and sagittal, B, morphological types of the heart and aortic arch, based on Kamina's classification. It compares the position of the aortic arch, 1, and the stomach, 2, in each type. The next chapter in our video is the topographic anatomical relations of the heart. The heart occupies 2/3 of the anterior mediastinum. The heart is in contact, through its pericardial coverings, with the walls and contents of the thoracic cavity. That are the muscles of the thoracic wall, the ribs, and the lungs. The anterior relations of the heart can be subdivided into the parietal and visceral relations. The parietal relations of the heart are represented by a portion of the thoracic wall corresponding to the lower 3/4 of the sternum, the third, fourth, and fifth costal cartilages, and the anterior ends of the corresponding intercostal spaces. They define the area of the cardiac projection. The anterior visceral relations are represented by the anterior borders of the lungs, and the pleural recesses, which diverge downward and outward, delimiting the interpleural triangle corresponding to the area of absolute dullness of the heart. The heart is in contact on each side with the mediastinal surface of each lung, on which it creates, particularly on the left, a depression, the cardiac notch. It is also in contact with the mediastinal pleura, and on the left, the phrenic nerve and the superior left diaphragmatic vessels. The posterior surface of the heart or base, entirely auricular, is subdivided by the interauricular sulcus into two segments, right and left, each having particular relations. The right segment is in contact with the right phrenic nerve and the inferior vena cava, and the left segment is in contact with the organs of the posterior mediastinum, namely the esophagus, the vagus nerves, the thoracic aorta, the thoracic duct, the azygous vein, and the vertebral column. The superior relations of the heart are represented by the upper floor of the mediastinum and its contents, namely the large vessels that are the aortic arch, and the bifurcation of pulmonary artery, and the brachiocephalic venous trunks, the thymic space, and the tracheal bifurcation. The inferior relations occur through the phrenic center with the large tuberosity of the stomach and the left lobe of the liver. When it comes to the apex of the heart, the latter in adults projects inward and below the left nipple in the fifth intercostal space. It is positioned higher in children at the fourth intercostal space and lower in the elderly at fifth intercostal space. Finally, let's address some clinical notes by detailing the precordial region. The apex projects into the sixth intercostal space, to the right of the midclavicular line. The vertical part of the right border corresponds to the right atrium. It runs along the right border of the sternum, from the third to the sixth intercostal space. The horizontal part of the right border corresponds to the right ventricle. The left border corresponds to the left auricle and right ventricle. The aortic focus is located near the border of the sternum, in the second right intercostal space. The pulmonary focus is located in the second left intercostal space, near the sternum. The tricuspid focus is located at the base of xiphoid process. The mitral focus is located in the fifth left intercostal space, on the midclavicular line. To conclude, the heart has a pyramidal shape with distinct surfaces and borders, fitting snugly in the mediastinum. Its external features relate closely to nearby structures like the lungs, pleura, and great vessels, ensuring efficient cardiac function.